All right, I am going to go ahead and we are live. Good to go.
Okay. Good afternoon and welcome to the last of our fall series of virtual brown bag luncheons sponsored by the Tompkins County Offices of Human Rights, Public Health, and the Chief Equity and Diversity Officer. I am Ken Clark, Director of the Office of Human Rights. We appreciate the time you've taken to join us for an important discussion we are calling Confronting a Winter of Discontent, Resources for Depression and Loneliness During the Holidays and the Pandemic. Our collective offices will assess this fall series and determine next steps for the new year of 2021. We want to thank everyone who has watched our live monthly events since September or who have tuned in afterwards. I also want to thank my colleagues who've been central to the planning and support of this series over the last 4 months. Dominic Recchio, County Communications Director, Samantha Hilson, Director of Health Promotion and Public Information Officer of the County Health Department, and Deanna Carruthers, Chief Equity and Diversity Officer. Stay tuned for more programming in 2021. Today's program is going to end at 12:45 to allow for preparation of the broadcast of the Tompkins County Legislature's Health and Human Services Committee at 1 p.m. on this same YouTube channel. Often the holiday season, when Hanukkah, the winter solstice, which is today, Advent, and Christmas in the Christian tradition, and Kwanzaa occur. When Buddhists, Hindus, and Zoroastrians commemorate events significant to their traditions. Often the season is synonymous or perceived as synonymous with celebration and festivity. Yet for many of our fellow citizens, this time of year is the beginning of a winter of discontent. Depression, sadness, loneliness impacts individuals from youth to seniors of all ethnicities, genders, sexual orientations, and identities and abilities. Nonetheless, we cannot discount the special impact of seasonal emotional and mental struggles on those from underrepresented, undeserved communities. Many live far from family, unable to see their loved ones. Others do not care to attend holiday parties, even if they are virtual, and tune out and turn off. COVID-19 travel restrictions have prohibited visitations with family and friends who live in the same region, not to speak of those who live across the country. The pandemic is also aggravating for those diagnosed with seasonal affective disorder, described in the National Center for Biotechnology Information article as a fall-winter major depression with spring-summer remission, which is also a prevalent mental health problem. On this first day of winter, we're joined by two specialists who can analyze these seasonal struggles and discuss resources to address them. Katherine Goldberg, Community Consultation and Education Specialist for Cornell Health, is a social worker who values the profession's values of social justice and the dignity and worth of every individual. Among her areas of interest are moral stress, compassion, fatigue, grief, loss, and bereavement, the impact of serious illness on family dynamics, the significant human needs and medical environments for family members of seriously ill patients and medical team members. She is also a veterinarian. Melanie Little is Director of Youth Services for the Mental Health Association of Tompkins County. She coordinates and facilitates mental health education programming, including mental health first aid and mental health and wellness one-on-one workshops in school classrooms and workplaces. Melanie is focused on combating the stigma about mental illness and educating adults about how to recognize signs of mental illness and actively support family members, friends, coworkers, and others in non-judgmental ways. She has been quoted as saying, being mentally healthy is the ability to make positive decisions, cope with difficult emotions, and enjoy one's life. Katherine, then Melanie will give their remarks, and then we will take questions from the online audience. Katherine?
Thank you so much for that introduction, and I'll be echoing much of what you have shared in terms of what we're really kind of dealing with right now in this moment. Can you see my screen okay? Did that all work?
Yes.
All right, technological miracle. I'm not very good with tech, so here we go. One of the challenges of the pandemic. So winter, you know, if we were in a room together, not a Zoom room, I might ask, when I say winter, what do you think of? What does that conjure up for you when we think about well-being in winter? And as you already so beautifully stated, for many people, it's like this happy, joyful photo on the right of all the things that we might affiliate with season and joy and all of the, togetherness of family and smiling. And yet, for many people, as you already shared, there are all these things that come along with winter: isolation and loneliness, the darkness when we are in a location like Ithaca, New York, that is fairly dark and gray. What is the impact of that on everybody? And then, of course, the holidays, as you already alluded to. So if you're a winter holiday person and you are fortunate enough to have a supportive network of people and good traditions and positive memories, and that might be a really wonderful thing to dive into in winter to help with your well-being. But we also know that family can be stressful. People who struggle with eating concerns and disordered eating and relationships with food and body image, that comes up very heavily over the holiday time. Relationships with alcohol and other drugs at certain celebrations and traditions and memories, the financial strain, right? So all of these things come with winter. And this is I would say a normal winter. This is when we're not even talking about a pandemic. So if you're a person who would be more likely to say, oh no, hold on, cold weather is not my jam, then that is okay, and you are not alone. This year, right? How many different ways? I think the word of the year was unprecedented or something, right? In the Urban Dictionary. We're so tired of hearing about how unprecedented everything is. But we need to address this, right? I think opening this up with what is the context in which we find ourselves, so that then when we hear about resources following my remarks, we know why this is different and why it is particularly important. COVID-19, no question about it. We are in the context of this enormous, important, and also very traumatic kind of social uprising around police violence that we cannot ignore. And the confluence of COVID with this is doubly, triply, right? It's an exponential loss upon loss and grief upon grief. So fires in both Australia and California and everywhere, we have a world that is literally burning. And oh, by the way, we had an election. So on top of everything, this is kind of the context. This is the water in which we're swimming, right? As we cope with winter approaching. So the mental health space, I thought it might be useful to just point out what a major transition it has been. And when I say mental health space, that is not just clinical delivery of services. Many of you on this call, I know, are integral to the mental health and well-being space of our community. You may be leaders, legislators, embedded in this work. And for many of us, that means we've gone to telehealth. And so I can share with you, I'm a social worker because I'm a people person. I am not a tech savvy person. I can only see a few of you in my little box here. And I very much wish that we could be together in a real human to human connected space, but we can't. And so a huge adjustment for many of us, whether it's clinical service delivery or programming and mental health, health outreach programming, probably for many of you have been on telehealth. And there are many benefits, right? I would much prefer to see my client and actually have affect, even if it's not in the same room, than having a mask. Because if I'm meeting with someone in person right now, I can't really read them. And that's a really difficult space to be for those of us who are trying to provide a safe and empathic space. We can have a continuity of care, of course, because we're not needing to just say, okay, we can't have services. So that's really a gift and a privilege to be able to do that. I do think that there are some ways in which the therapeutic alliance has been deepened in a really kind of surprising way, in the sense that, you know, I'm a human, you're a human, here I am in my house. Well, that's kind of weird. You know, in the college mental health space, there's a little bit of a falling away of kind of the wall between the therapist and client, which I have found to be immensely helpful and really interesting in the ways that we may have thought through our training or experience or otherwise, that if I reveal something very personal about myself, maybe that will be damaging, maybe that's going to be a problem. But now here we are, we're in our homes, and, you know, I live on a farm and my students hear my roosters crowing. And so there's been a whole lot of disclosure about, like, what is that noise in the background, and worrying about what that will be like. And so I'm sure many of you have similar experiences of kind of that that barrier to the relationship falling down and maybe being a good thing. And of course, pandemic safety, we're all able to do our job and not worry about transmission of COVID. So immense benefits with all of this. However, also burdens, right? With anything, the technology requirements, I mean, don't even get me started, right? Like, my internet barely supports the Zoom meeting that I'm on now with you all. So that is a struggle for many people. It also highlights this issue of really, like, broadband as a rural equity issue. And so I think that that, in a way, has been an important highlighting of what are the concerns around internet and broadband as a utility, as like a social justice issue in terms of access, whether that's for schooling, for healthcare provision, or otherwise. We have to worry about privacy. Those of you who are in a HIPAA ensconced space, right? I can't do this in my home with any other human here. And so there are some logistical things to consider there. There's also an emotional burden for many of us in terms of literally having our work in our home, and in our marriages, and in our partnerships, and in our families, and in our, like, space where we eat and live and play. And that might have been a boundary that many of us as mental health providers and well-being folks have worked really hard to kind of cultivate a boundary. And now the boundary is gone. And so that's an important piece as well. And then, for sure, clinically, one of the concerns about telehealth is when we have very high-risk clients, and there are really legitimate safety concerns that we have to worry about, and that can be a challenge. So this is all to say that we all who are in this space are impacted. And I just think partly because it's my bias and my kind of professional interest in the health and well-being of caregivers, and also of seeing challenge through a lens of grief and loss. It is my strong belief that grief and loss is kind of the architect of our whole life. And so we have a very unique moment right now to recognize what is the impact on the people we're serving professionally, but also what's the impact on ourselves. And we are certainly impacted. It would be unrealistic, as this quote, you know, very beautifully shares, to expect that we wouldn't be impacted. I'm going to skip over some of this for just the sake of time, but please remember that compassion fatigue is not the same thing as burnout, right? Compassion fatigue is something that is unique between the relationship between the provider, the caregiver, and the client and the patient. And so this idea of the cost of caring is this emotional residue that will follow you wherever you go. It doesn't matter if you change your work team. It doesn't matter if you change your boss. It doesn't matter if you change your schedule. That is the residue that's with you. Whereas burnout, right, is chronic workplace stress that has just not been successfully managed. So the difference between the relationship between the caregiver and the patient, or the client, and the caregiver and the work environment. And so I think that as we think about winter and what we need to do to kind of help ourselves, thinking about that in terms of what are our work teams doing to help all of us cope with this? What's the work environment look like? Because this is going to be important for not just our clients and the communities that we serve, which often is the primary thought, right? Of like, how is this going to help the community, who is the community in need, so to speak. But I would just offer curiosity around the idea that we are all right now a community in need, because we are humans and we are experiencing a uniquely challenging kind of affront to humanity and what we know we need as mammals, right? We need connection, we need closeness, we need all of these things that we are taken from us right now for good and important public health reasons, but I think it's important to recognize the impact of the things that have kind of been taken. So my kind of operational definition that I use with students and community members around like, well, what is well-being anyway, is really very simple. It's just resources plus demands. And there's kind of no way around that very simple equation, right? That means that when I talk to my grad students who are in, their very high demand programs, I tell them that those demands aren't going away. Like one way to make your well-being improve is to just get rid of all the demands you have. But that's not going to happen. And for all of us who are humans living through everything we are right now, those demands are going up and up and up and up and up. So the only way that we can maximize our well-being is to concurrently increase our resources. There's kind of no other way around it. And so, high input, high output is one other way to think about that. But I think giving ourselves some gentleness around what we are expecting of ourselves in this current time that is unique, on top of kind of the first, oh my goodness, here we go. What's unique about trying to have a computer up on your stand so you can be seen? There you go, human moment. The original slide of what is expected during a regular winter, and then pile on everything on top of that. That is a high, high demand. So one framework that I really wanted to leave you with is this healthy mind platter. I'm not sure how many of you are already familiar with this. If you're not, this is Dr. Dan Siegel. You can Google healthy mind platter and read all about it. But it's modeled kind of after the nutritional pyramid, right? This idea of what do we need in a day for our health? And this is what do we need in a day for our brain health? And this is all of the things that are very research-based, right? We hear about sleep and exercise and all the things. But this puts it on one platter that helps us to say, okay, if I'm feeling really unglued this winter or any other time, what is it that I have and what is it that I need? Like maybe I'm getting really good sleep, but I haven't had any physical exercise. Or maybe I'm doing really well. I tell all my students, focus time is like work time. None of us need any more of that. Like we're good on focus time. We don't need any more of that. Everything else, right? The connecting, the play. Play is like genuine play. If you think about children or animals running around and playing for just no reason other than play, how often do we do that as adults, right? Downtime is different from time in. So time in would be reflective time or mindfulness practice. Downtime is nothing. I have a lot of hard time with this. Many of us do, right? Downtime is nothing. You're not reading a book. You're not watching a movie. You're like maybe looking at a bird, maybe, but that is downtime. And if we're not getting that every day, then we're missing one of the ingredients that's on this healthy mind platter. So I would encourage you to check this out if that's not something that's familiar to you. I use it with clients all the time, and it's a very helpful way to kind of craft a self-care plan of what do you need from this thing that you're not getting. So I'll leave you with just a quick video before we go to resources about one way to deal with time in.
You may have heard this word mindfulness. It's become something of a buzz phrase of late. I'm going to give you one simple, serviceable definition, which is this. Mindfulness is the ability to know what's happening in your head at any given moment without getting carried away by it. Imagine how useful this could be. Just as an example, driving down the road and somebody cuts you off in traffic. How do you normally react? I think most normally react by having a thought, which is, I'm pissed. And then what happens next? You immediately, habitually, reflexively inhabit that thought. You actually become pissed. There's no buffer between the stimulus and your reaction. With just a little bit of mindfulness, in that same situation, you might notice my chest is buzzing, my ears are turning red, I'm having a starburst of self-righteous thoughts, I'm getting angry. But you don't necessarily have to act on it and chase that person down the road, screaming at them with your kids in the back of the car thinking you've gone nuts. Now, you might be thinking, don't I need to get angry sometimes? Aren't I justified? I would say yes, but probably not as much as you think. The proposition here is not that you should be rendered by mindfulness into some lifeless, non-judgmental blob. The proposition is that you should learn how to respond wisely to things that happen to you, rather than just reacting blindly. And that, my friends, is a superpower. How do you get it? The way to get it is through meditation. I believe that meditation and mindfulness are the next big public health revolution. In the 1940s, if you told somebody you were going running, they would have said, who's chasing you? But then what happened next? The scientists swooped in, they showed that physical exercise is really good for you. And now all of us do it. And if we don't, we feel guilty about it. And that's where I think we're headed with mindfulness and meditation. It's going to join the pantheon of no-brainers like brushing your teeth, eating well, and taking the meds your doctor prescribed for you. Let me just close by saying, mindfulness is not going to solve all of your problems. It's not going to render your life a nonstop parade of unicorns and rainbows. Nonetheless, this is a superpower, and one that is accessible by you immediately.
Okay. I will turn it over. Melanie.
Great, thank you. I love that was it the happiness platter, the wellness platter?
We have a healthy mind platter.
Healthy mind platter, yeah, that's a really great model. So thanks, Catherine. I'm going to echo some of the things that you've shared with us, and I want to share a little bit about what things are looking like for the folks that we're working with who have pre-existing mental health conditions, as well as the things that we can do for self-care and the resources that are available to us in our community. So I'm going to go ahead and share my screen here. Let's see. Oops, wrong share. Bear with me, another human moment. Okay. So staying well this winter. So as Catherine mentioned, we have this winter around us. This is kind of what it was looking like a couple of days ago. And folks may have very mixed responses to seeing this kind of scene. For some of us, this may feel really beautiful and wonderful. For others, it may feel even a little scary to see this kind of image and see our environment change like this. I wanted to take a minute to look at some of the numbers that we're seeing to highlight kind of 2 points. One being that it is really critical right now that we're practicing different things to protect our mental health, because we are kind of seeing these parallel pandemics. Certainly we have COVID-19 happening. Also, we're seeing mental health issues on the rise. And also just to know that if you're experiencing some of these things, like Catherine said, you're really not alone. This is happening kind of across the board. So the Department of Health and Human Services issued a study recently that found that people who are experiencing symptoms of an anxiety disorder has risen in the past year from around 8% to over 25%. And for symptoms of depressive disorders, that has risen from about 6.5% of the population also to over 25%. So we're seeing about 1 in 4 people right now that are exhibiting symptoms of a diagnosable mental health disorder in anxiety or depression, which is pretty high. There's been an increase in suicidality, certainly an increase in use of substances to cope and substance use disorders. And we also are seeing folks with pre-existing mental health conditions seeing an increase in severity of symptoms. So there's certainly some reasons for that. One thing that I've been noticing a lot is that for people who have been actively working on their recovery, trying to heal from the mental health issues that they're facing, a lot of their goals are being interrupted. A lot of folks were working on expanding their social support networks, overcoming some of that social anxiety, and now they are struggling to find ways to meet people. Maybe they were seeking for employment and those opportunities are less available. Maybe they're in a position where they can only work remotely. So that's been a real challenge for folks. Certainly employment disruptions are impacting people's ability to access mental health services as well as to meet their basic needs. Like Catherine discussed, there's been sort of mixed experiences with telehealth. Some people really love it, and some people are kind of falling through the cracks. And certainly, we've talked about the impact of our social political climate that has been a huge source of tension, anxiety, anger, trauma, conflict in families. And then something we're hearing over and over again is isolation. Right. For many of us, this may be something we're experiencing as something new. And for many people with mental health conditions, they may have experienced isolation as a result of the symptoms that they were experiencing. And this is something that's been kind of exacerbated. And then certainly boredom. Being home and not having as much to fill our time, not being able to go out and do the things that we may normally do, folks are maybe seeing an increase in those negative thought patterns, those anxieties, because we have less to distract ourselves from them. So that can be really challenging. And we've also talked about seasonal affective disorder. This affects roughly 20% of the population, about 6% of the population with real severity. And it also very frequently co-occurs with pre-existing mental health conditions. So there's sort of this 1-2 punch of dealing with both of those things in our current climate as we're heading into this winter. So one of the most important points I want to make today is that preparation is key. So just like you might be doing things right now to winterize your house, I put plastic on my windows this past weekend because it's getting cold in my room. Maybe you're stocking up the medicine cabinet, getting ready for cold and flu season, that kind of thing. There are also things that we can do to kind of winterize ourselves for our mental and emotional well-being. So one thing we really like to encourage people to do is make lists or written plans. We really like to encourage this because when you're dealing with a mental health concern, if you're experiencing a lot of anxiety or depression, it can be hard to think straight. It can be difficult to remember what you need to do, what you have access to. So I have sort of 3 lists I would encourage folks to make as we head into this winter. And one is that everyday maintenance, which I feel like that Healthy Minds platter fits right into. So thank you for sharing that, Catherine. I just love that. So these are the things that need to be done for everyday wellness. So things like nutrition, sleep, movement, but also just doing activities that you enjoy, that make you feel connected to others. Maybe you have spiritual practices, creative activities. One of my everyday maintenance items is I have to listen to music in the morning. So these are going to be unique and specific to you, but the things that you feel are important for you to do every day to feel okay. It's good to make a list of your coping strategies or any kind of safe activities that can help you to get by. Things that can help you to relieve stress, distract you when you're feeling overwhelmed. It's okay to distract yourself once in a while. And things that may help you to process difficult feelings and experiences, whether that's journaling or talking to someone, meditating, things like that. And then to make a list of your support system. Sometimes we can get in a place where we feel a lot more alone than we really are. And so making a note of who you can turn to for support and connection. That may be friends, that may be family members. It may even be an online community like a Facebook group or something you're involved in, your neighbors, if you work with mental health providers, or even your pets. So really keeping kind of an inventory of what you have available to you. So when you're really struggling, you can pull those things out and you have that kind of backup plan or that self-care plan to jog your memory and remember what you need to do and the resources that you have access to. And some additional self-care tips here. Again, really prioritizing those basic needs, nutrition, sleep, staying hydrated, moving your body. These are all things that it's kind of easy to let go of, especially if you're working from home, feeling exhausted and overwhelmed. So even if you have to set a reminder on your phone to drink water every couple of hours, right? These are things that are really critical to maintaining our sort of baseline. Getting outdoors I know it's cold, but even if it's just taking a little extra time to be mindful on your walk to the mailbox, or taking the dog for a little bit longer of a walk or visiting a park, can really do a lot, especially for that seasonal affective disorder and those symptoms. Also, practicing gratitude. Research shows us that regular gratitude practice can help to lift your mood. Keeping a journal to keep note of these things. And again, practicing self-compassion. It's perfectly normal and okay to not be okay right now. We're dealing with a lot in our world, and just really taking the time to honor where you are and that you're doing the best you can under the circumstances. And that may mean lowering our expectations of ourselves a little bit, giving ourselves a little bit of grace, knowing that we're all in these challenging times. So I wanted to talk a little bit about how we can find additional support if we need it. So if you find that your mental health is disrupting your relationships, your ability to work or do your daily activities, you may benefit from some additional support. So this isn't about, there's something wrong with you. This is about, there may be people out there who, like Katherine, have dedicated their whole careers to helping people who are going through these things. So talking to your primary care doctor can be a good place to start. They may be able to refer you, they may have some good ideas. And if you have that existing trusting relationship with that person, that can be a really good place to start. If you're employed, your employer may offer an employee assistance program where you're able to access some free counseling through your employment benefits. That can be a great resource. If you're looking to find a therapist or someone in private practice, psychologytoday.com has a really terrific database that allows you to search for folks based on location, insurance, specialization, all of those things. That's a great place to start if you're looking for a provider. Your insurance company also may have a directory that you can look at. And we also have 2 mental health clinics in our county, and those are Tompkins County Mental Health Services and Family and Children's Services. Peer support can also be really important, connecting with people with those shared lived experiences. That's kind of our specialty at the Mental Health Association in Tompkins County. We offer a number of peer support groups over Zoom that take place during the week. We operate a warm line, which if you think one step down from a hotline, right? So when you really need someone to talk to, maybe you're not in crisis, but you're feeling alone or you have things you need to work through. We have a number you can call from 9 to 2 on weekdays. And we have peer specialists, which are people who have lived experience with mental health issues, who have been specially trained to be able to support you and help advocate for you when you're dealing with those things. Ithaca Community Recovery is our local resource for 12-step meetings. So if you're dealing with a substance use disorder, they're a really wonderful resource. They're available in person and online. The National Alliance on Mental Illness offers peer support for friends and family members of people with mental health disorders, which can be a challenging experience. And additionally, if you go to warmline.org, you'll find a directory of warm lines across the country that are available at all different hours where you can connect with a peer for support. And we also have a number of crisis resources that I've listed here. So we have our suicide prevention crisis line. We have a local number, so those folks would be most connected to our local resources for referral. But there's also a toll-free number to connect with the national service. There's a crisis text line, which can be really helpful for folks who are maybe not comfortable having a live conversation about these issues. There's the Trevor Project, which specializes in supporting LGBTQ youth, which are a population that are at particular risk right now. And also Tompkins County Mental Health Services is available for walk-in evaluations for people who may be feeling in crisis and like they need to be seen that day. So you can contact them for details about that. So that was a lot of information, but we do have a lot of really great resources here in this community. So yeah, we can turn it over for questions.
Okay, do we have any questions from our online audience?
None have come in yet, but if individuals want to put any in the YouTube chat, I'll pass them along to you all as soon as they come in, but none have come in yet to this moment.
Okay. Okay, well, one question I might start off with would be this, and some of it was sort of implied in some of Katherine and Melanie's responses. While technologies such as Zoom and FaceTime connect one with loved ones and friends in ways that have been unavailable in the past, how might one address creeping techno fatigue, shall we say, and mental, emotional struggles?
I can take this to start if you want. It's like you're speaking to me, because one of the things I've been joking with all my students about, and of course, I work with undergrads and grads. These are like emerging adult age type, folks who know that I have like an enormous soapbox about how horrific, technology and social media in particular is for mental health. And it's been a little bit humbling for me to really a bit where we are right now. Everything that we know about social media and mental health. I mean, certainly, I'm not saying it's across the board a terrible thing. There are certainly online communities that are useful for people. However, by and large, right, comparing ourselves all the time to what's going on with other people is just one of the many concerns around living in an online fashion in a social media community. And so I think for myself, I will share that I have had to modify, I guess, my very strong feelings about this from a mental health perspective. I don't think you're going to have very many mental health clinicians who are really very pro social media generally, just because it's such a concern. But I think being able to step back and say, okay, well, we can't, as John Kabat-Zinn says, we can't get rid of the waves, but we can learn to surf. So what is the environment that we find ourselves in? Okay, well, I don't have any social connectedness in a normal, typical way. I know that is required. That is required for my neurobiology as a mammal. Like that it prioritizes, above anything else. And so if I need to then have some screen time in order to get that need met, then so be it. But I want to be really intentional about it, and I want to be really mindful about it, and I want to be really aware that I am compromising. I am making a compromise on one list in order to fulfill a need in another way. And so I think it's just intention and being aware that there are some real health risks too. I will say these are blue blocker UV light glasses. I do not typically wear glasses because when I started doing all of my sessions, I was feeling like not well. I mean, I was feeling like I had weird vision and I'm not a headachy kind of person, but I was just feeling like blah. And it turns out that, a lot of screen time is pretty detrimental. So being aware of not only the emotional impacts of it, but the physical ones, and doing what we can to, if we need a break from Zoom, can you do a phone call? Can you do something to get yourself away from the screen? Because it's a very like benefits and burden relationship for me. So, yeah.
Melanie, do you have anything to add to what Katherine said?
Yeah, I have. So one thing so I work with youth primarily, right? And there have been some stats that have come out that youth often feel that their technology use is a resource. And, adults may have mixed feelings about that, but one recommendation I, try to make, I'm a millennial, I'm on social media a lot myself, full disclosure. But one thing that I really encourage people to do is curate your feed. So again, that idea of being intentional, right? If you're on Instagram, if you're on Facebook, if you're on these pages, if you see stuff that makes you feel bad, unfollow that person. Out hashtags, accounts, things like that are uplifting to you. I follow a lot of different peer support organizations and providers, and even there's therapists out there. I mean, Instagram is not therapy, but you can get good advice and ideas and things that are inspiring. So really being intentional about the social media that you're consuming so that it can be potentially of benefit, as opposed to seeing like the fitness gurus that you're comparing yourself to, or the people you went to high school with that it'd probably be best if you didn't even think about them anymore, right? So being intentional in that way. And yeah, taking breaks. Set a timer on your phone to get up and walk around the block, meet those basic needs, because we can get so kind of stuck in the screen. I refer to it as a black hole sometimes, right? It can be hard to pull away from. So holding yourself accountable in that way.
Well, I think too, both of you kind of speak to issue that I can remember when I worked at Penn State. There was a professor, Rustum Roy, who talked about, this was in 1997, talked about this was not really so much an information age as an age of data overload. And that there's a challenge to separate real information from the data that we get. And that's all the more so now in this age of, in which you have a lot of false information, misinformation, and outright lies that are being transmitted through social media. And I think what both of you said really in many ways kind of implicates that need to kind of separate real information from data and determine what we're going to tap into, what we need to turn off. So another question I have for you is talk about the challenge of helping people, or of overcoming stigma and helping people overcome a winter of discontent.
Yeah, I can start us off with that one. So in a strange way, I think this year has maybe moved us forward a little bit in terms of stigma, because many people are experiencing things that those of us who live with mental health conditions are used to for the first time. So it's, I think, enabling people to have some more empathy and compassion for those kinds of experiences. And one thing I kind of tell some of the folks I work with is that, in a way, those of us with lived experience are kind of experts on this. People are having to figure out for the first time how to make a self-care plan or a safety plan. And folks who've been in treatment and doing those things, oh, we know how to do that. We can even share that information with people. And that, I think, highlighting those strengths that come from that lived experience is a good thing. I think somewhere we continue to see a lot of stigma is maybe those less common and more severe disorders. So anxiety and depression are very kind of accepted depending on the severity these days. But things like schizophrenia, bipolar disorder, personality disorders, those kinds of things are still highly stigmatized. And those are things that are being exacerbated right now. So as well, right? So I think those are areas where, we may need some more education and just being in that position of kind of curious observation. So when you see someone behaving in a way that doesn't make sense to you, instead of placing a judgment on that, thinking, I wonder what's going on. And we don't need to know, right? We don't need to know the details, but kind of entertaining that notion that there's probably more than meets the eye here. And if this seems really strange to me, but kind of having that humility of knowing that we don't know that everything that's going on or what that experience might be for that person. Okay,
great, thank you. Katherine, anything to add? And I would say, rather quickly, we've got about a little less than 2 minutes.
No, I think Melanie said it so beautifully. There's really nothing else to add. I just echo everything, everything that was just said. And I guess I will add a little anecdote around exactly what you're saying, where people who have lived experiences, I've been telling my students, like, that's your superpower. Because in fact, like, this is, how to do this. Like, you've been doing this and how to do it. It's just in a different context. And in fact, some of the clients who we might have been worried about in terms of being very high risk are doing better than expected. And some of the people who we might have thought are actually going to be doing fine and are very resilient are doing worse than expected. So it's a very like humanizing, equalizing experience. So I agree with you there. Yeah.
Well, I want to thank both of you so much for joining us today, and thank our online audience as well. And we're going to be ending at least this fall series, but we'll be coming back in the spring. And again, thanks to all of you who participated in these events, and thanks especially to our two guest speakers today and our colleagues who helped to make this happen. So we will bid you farewell and hope to see you in the new year. Thank you.